We take care of patients from the moment they arrive at the airport. Usually, patients are not from the city. They have to travel. And so if they know that they're taken care of from the airport, and then when everything is done, they're brought back to the airport, it makes the experience easier.
That was really fantastic to just, you know, have the driver pick me up, take care of the bags, just take care of everything and get me where I needed to be.
And he was great. He took me and dropped me off, well, took me to the bed and breakfast that I'm staying at so I could leave my luggage and then come straight here with Ashley and be here and check in with her and you know, see where she was going to be. And that way she saw where I was going to be too. And it's not very far from here, so it was great.
Rather than, you know, staring at maps, you know, we just had a ride and everything was taken care of, and we didn't have to sit there confused and scared.
Yeah.
It's a small private hospital. It has 17 beds, 3 ORs. We do 1,200 surgeries a year. We do cosmetic surgery, we do SRS, we do also orthopedic surgeries, and there's also a bariatric surgeon. I'm the general director of the place. I'm the owner.
You know, I've been in hospital before having children and some surgery, and it was excellent, top-notch.
Yeah. The staff was great. You know, although French is the predominant language, everybody there spoke enough English that I never felt like I wasn't being taken care of.
We have 2 accreditations, but the most important one is by the Canadian Council of Accreditation. And it's like the Medal of Honor of standards of care and surgeries and all. We're very proud of that.
It had more of a small neighborly hospital kind of feel to it.
And they greeted us, you know, like with the mom. When I would come in, they all, you know, they all greeted me and would bring me coffee and just make sure that I was okay, and was always glad and very welcoming. So I never felt in the way or that they didn't want me there. They were very happy to have me there, and they took excellent care of her. And that was a relief too, of course.
Post-op care for SRS is really important to the success of the surgery. Having our own place for convalescence is really important. It has 10 beds, it's right beside the hospital, it's near a park, near a river, and it's right on the island of Montreal, so patients, when they come, they usually come a couple days before their surgery, they get acquainted to the place, they meet other people.
I'm close to them. I share a lot. That's what I love the most, giving care and feeling that it's really appreciated.
They come here, okay, they get the surgery, and we are the first contact with them. So I feel like they're my family. I laugh with them, and I make them feel comfortable.
Compassion, empathy, safety. I mean, these are our goals. So I mean, the staff are chosen on that basis.
I felt comfortable even before we came here that Erin was going to get the very best of care because I knew that they had the convalescent center, and I knew that she would have round-the-clock nursing. That was extremely important to me, that she wouldn't be released from the hospital and be on her own.
The staff couldn't be more accommodating. They bring our medication when we need to have it. We have our meals on time. They explain everything they're doing. I was pleasantly surprised by the care here at the facility.
As a parent, I feel like she could be here, be well taken care of 24 hours a day, and I did not have to worry about that.
Anytime I needed something, whatever it was, a question, pain medication, anything, you know, the nurses have all, both at the hospital and the residents, have been very responsive.
I can't even begin to imagine how Dr. Brassard has been able to create this environment that is so comfortable, it's so warm, and the staff here is so loving and caring. I'm blown away with it. I mean, I wish I could get staff in my store, in my shop, the way Dr. Brassard has put together this wonderful staff in this wonderful facility. It's amazing.
The standards of care are the highest. Started medicine at 18, finished that at 23, did my training in plastic, and had my diploma. I was 27, started practice at 28.
His work is so beautiful, so professional. He has so much attention to detail.
I'm doing something very exclusive for patients who are not really well cared for by most doctors.
Dr. Brassard is an amazing choice. You, of course, have to take your own circumstances into consideration because everyone can have different needs. But if he's a good match for you, he's an incredible surgeon. He's a wonderful man. Both with him and the staff here, you genuinely feel how much they want you to heal and to have great results and for everything to go well. Yeah.
Dr. Brassard's just a natural choice, as far as I'm concerned. I mean, I can't even think about anybody going to any other doctor. But I'm biased. I mean, I think he does great work, and I'm thoroughly satisfied with it.
Happiness, relief, happiness very much, yes. They finally go through something they were waiting all their life, and even with the pain and the surgery, they are very, very happy.
Patients will tell me, "You saved my life." Well, what I really did is I did a good surgery for them, and while they were around me for that period of time, I gave them the best they could get. But I tell them, I did not save your life. I know a good surgery, and I do a good job, but you saved your own life yourself.
Never for 1 second have I regretted having the surgery. The surgery was almost a non-issue. It was just a natural stepping stone to becoming who I really am.
When everything is done, I want people to feel that they've had the best possible experience they can get anywhere.
I tell everybody when they leave, if you need to talk, if you have just questions, call us.
I have been so impressed with what I've seen here and truly happy that this is where we chose to come.
Doctor-patient relationship is something that really drives me, and actually the whole setup you've seen is all oriented towards the patient. Safety, well-being, and quality of care, and of course quality of results.
The butterfly as a symbol because they are changing during their life. In French we say métamorphose, and that's the transition of the people that are coming here. They are changing their life.